Thank you very much for that nice introduction, and I really appreciate the opportunity to be here with you all today. I don't have the benefit of having been a part of your conversations yesterday, so you'll have to excuse me for that, but based on my conversations with some of you and what I heard here this morning, my understanding is that in essence you have some very exciting, very promising innovations, family-focused innovations, and some examples of initial spread of these innovations, and are looking to really more systematically and creatively think about expansion. And that's wonderful. That's certainly my interest. That's what I do. I am neither a subject matter expert in your subject matter nor a researcher, but I am a practitioner in the field of large-scale change. So what I think my most useful service could be to you is to essentially talk about what seems to be the most interesting and innovative things that are happening in this field, in this space, drawing in fresh perspectives and different perspectives from other fields and other sectors, and hopefully leaving you with 2 or 3 sort of concrete, actionable ideas that might be useful to you. I will start just very quickly by laying a little bit of groundwork with sort of the prevailing theory, just so that we're all on the same page, although I think this group has a lot of mastery of the subject matter. And then I'll actually just sort of talk about some of these exceptional cases and try to pull out what makes them different and special in hopes that, again, it might inform you a little bit. Before I do that, I just want to define terms a little bit, not because you don't know what these terms mean, but because I use them in a very precise way, and I find that they're actually used imprecisely sometimes and interchangeably sometimes. So when I talk about expansion or spread, I want you to know what I'm discussing. Prototyping is, of course, testing and adapting new ideas to learn what works in your system. Basically, it's the testing of the innovation. Piloting is applying it to a slightly larger, more varied audience. And then spreading is actively engaging individuals outside the pilot to adapt the practice to reach the largest audience possible. It's sort of, spread typically has the connotation of wanting to go to full scale. And then scale up is something that I think of very differently, which is addressing the infrastructure issues that arise during spread. And I just wanted to make that distinction clearly, because I sometimes find that scaling and spreading are used interchangeably, and I think that they're 2 things, at least in my vocabulary. So I wanted to clarify that. This slide here is kind of it's an obvious slide in a way. It just sort of lays out the progression from prototype to pilot to spread based on increases in degree of belief, which have to do with increases in evidence and confidence. But I wanted to make 2 points in pointing to this slide. The first is that groups don't often know where they are in this sequence. And I do think that there's an argument to be made for deliberately saying we are in the pilot phase, we're in the prototype phase, we're in the spread phase. So there's an importance to that. In addition, you can see in the y-axis there that the degree of belief is kind of what we're using to decide whether we move from stage to stage. And I would also say that I think that a lot of initiatives tend to take too long to move from prototype to pilot to spread, and I think our thresholds for action are too high. I think that in part because there's a moral imperative here, which is, when things work, when we've established efficacy, it's time to start to spread as aggressively as we can. But also because I think that the whole process is an adaptive one, and so that we have license in every phase to do adaptation, and even when we're spreading, it's not pure replication. There's really an adaptive quality to it. So once we're in the spread phase, though, this is this prevailing theory that I talked about, which is essentially that in order to succeed at spreading, there are 4 things typically that you hear are important. And someone mentioned Everett Rogers earlier, and this draws heavily on Rogers. You need a well-refined intervention, a deep knowledge of the intended audience. You need to be able to segment who you're spreading your idea or your practice to. Some method of persuasion, a way to sort of increase tension for change or increase awareness and energy. And then some method of dissemination of knowledge, essentially a method for people to learn how to do the new thing or how to do the new practice. The well-refined intervention piece can be thought of through the lens of Rogers' 5 attributes of an idea that facilitate adoption. And I think this is a good and useful checklist. Relative advantage, you can clearly see the benefit of this new idea or new practice. People often say it's the difference between round wheels and square wheels. It just has to hit you over the head with its benefit. Simplicity or straightforwardness, being designed in a streamlined way. Compatibility really refers to values, making sure that this is aligned with the values of the adopting audience. Trialability and observability I view as kind of twins. You have to be able to test something and see the results of what you've tested as quickly as possible. And if it's going to take 3 months or 6 months or 9 months, you're going to have a problem persuading people to adopt it. For that second dimension, which is around understanding the audience and mastering the audience, hopefully this will, there we go. I was looking very naked there for a second. What Roger says is there's, for any innovation and for any audience, there tends to be a breakdown that looks something like this. You have your innovators, those who are always at the cutting edge and have been working on this maybe for 10 or 12 years before they even realize they've got something. Early adopters, those who study the innovators and decide whether or not their idea is worth carrying forward, often the opinion leaders in a given community, and then early majority, late majority, and traditionalists. The importance is that there's some intentionality about the work that you're doing for these different audiences and these different segments. The third idea, which is about increasing persuasion and stimulating people to actually adopt a new practice or changing their minds in a way, there's a long list of stimulants that we can look at and a long literature on what seems to persuade people. You'll hear me say more in a minute about the fact that I think it's important to draw upon many levers, and there are really hundreds of these that have been documented pretty thoroughly. I think Gene Sharp has 199 or 202 or something like that. So there's a long list running the gamut from positive carrots to negative sticks. And then the final piece is, having this method for dissemination, this way of teaching or this way of imparting new ideas. And here, again, just a very small subset of the different approaches and methods that can be used, but based on the complexity of the intervention, based on the size of the audience that you're trying to reach, based on the resources that you have, based on the time frame that you have, these are different methods or different approaches that might be appropriate in a given circumstance. Just again, I'm kind of giving you the basic prevailing theory, and this I would say is what we taught at the Institute for Healthcare Improvement for a decade. This is what you'll sort of have assumed as the basic thinking for a lot of people who work in spread. But what I found as of about 5 years ago was that we were studying a lot of large-scale change initiatives, and in my work I see scores of them every year, some from inside healthcare, some from outside. And what we found is that, of those that were committed to this framework and thought through these key considerations, still, and that's probably 50% of all the initiatives I see, really think through these things pretty thoroughly. Of that group, maybe a quarter are successful. So the question for us became a gnawing question at IHI at the time was, what's the differentiator? What makes some of these initiatives succeed and some of them really not do so well when it comes to taking things to scale? And I had sort of an epiphanous moment when I was part of an initiative called the 100,000 Homes Campaign, which led me to a new set of thinking along these lines. I don't know how many of you are familiar with the 100,000 Homes Campaign. It was on 60 Minutes about a month ago. It's a national initiative to reduce chronic homelessness. It's in over 200 communities now. They've housed over 90,000 people in the last 3 years, put them in permanent supportive housing, which is to say housing with chronic disease management supports, substance abuse supports, job counseling services, and they've had terrific success at keeping people in this housing. It's an incredible initiative led by a woman named Becky Canis, who I think walks on water, just probably the best leader of large-scale change that I've seen. And I really began to study it. I helped them for their first 6 months as they launched the initiative, but then I just studied it as they went. And I tried to figure out what set them apart and what distinguished them and what distinguished initiatives like theirs. And so what I want to do here in just the next 10 or 15 minutes is just lay out for you what I think are some of these unique differentiating factors and these keys to spreading that I'm hopeful you'll think about as you do this really exciting and important work. And the way I've laid this out is in terms of pitfalls, which are, I think, sort of maybe the common ways of behaving that lead to not so great results, and keys, which are the breakthrough ideas that you see in these exceptional initiatives. And here is the dashboard, an outdated dashboard from the 100,000 Homes Initiative, but I'll be talking more about them as I go. So I think the first pitfall is vague goals. And I mean, anyone who's sort of in the field of spread would tell you that if we can't say explicitly what we're trying to accomplish and the date by which we're trying to accomplish it, right away, that's a significant voltage drop in terms of the energy we have for the thing and the focus that we can get in the actions that we're asking people to pursue. By contrast, having explicit objectives is very, very meaningful. It tells us where we need to go and the time by which we need to do it. And the rule of thumb that seems to be very durable and work well, and it comes from, I learned it from someone named Tom Nolan, who's at Associates in Process Improvement and does a lot of work at IHI, is the rule of 5x to 10x, which is, if you've worked with 10 organizations in your first phase of work, generally speaking, going to 50 to 100 is about the right range for the next phase of expansion in terms of what seems manageable. You lose some control as you expand, so that sort of gives you a little control as you're expanding. And infrastructure-wise, it allows you to manage the scale-up challenges associated with expansion as well. So 5x to 10x seems to be a really good rule of thumb for those initiatives that do especially well. In the 100,000 Homes campaign, which has this aim of housing 100,000 people by mid-2014, the math was very, very detailed. They went sort of city by city in the country, saw what they currently had in terms of chronically housed homeless people, and then they extrapolated using that 5x to 10x rule, and were able to sort of come together and say, if we can reach 200 communities that represent mega cities, large cities, mid-sized cities, and smaller cities, we actually have a fighting chance at getting to that goal. So there is an arithmetic to it. It's not a perfect science, but there is some arithmetic that actually gets done to get to that aim that you ultimately set. So that's sort of observation number one. Observation number two is these initiatives that do especially well are not deeply invested in exhortation or pushing an idea, sort of saying to people, we really believe that housing chronically homeless people is crucial. You have to do it. Why aren't you doing it? That's the subtext that you see in a lot of initiatives that don't do so well, versus what you would observe in something like the 100,000 Homes Initiative, which is an almost total focus on barrier removal. And when I talk about barriers here, there are two kinds of barriers. There are operational barriers, and it's certainly important to remove operational barriers, and I'll talk about that more. But these are psychological barriers. Here I'm thinking a lot of the work of Keegan and Leahy, the idea that when someone is asked to make a change, usually their reluctance to do the change is less about the thing you're asking them to do and more about something that they're holding on to. Something else that's important to them that they value, that they feel they would have to give up to do the new thing. So thinking very explicitly about those things that they're holding on to is crucially important. Some of the barriers are, have to do with the fact that there's a crowded marketplace of ideas and people are just overwhelmed. But a lot of the times people have values that make them hold on to the prevailing way of doing things. We say inertia, but I actually think that inertia means being caught in these ruts of behavior. Defensiveness is an expression of this. People who sort of say, if you're asking me to do a new thing, you're implicitly criticizing the thing that I'm currently doing, and I've done it for 10 or 12 years, and I'm proud of it. So we have to think about that. Workload. Weak hypotheses about what spreads new practice really actually just refers to the idea that I think we tend to rely too much on traditional modes of communication, publishing, websites. It's sort of in the comment that our Norwegian colleague made about not doing so well at applying things at scale. I think we trust these diffusion mechanisms that actually don't change behavior. And so again, we're not going to these to what really people are holding on to. And of course, fear is probably the meta expression of each of these barriers. The third thing we'd observe is what I call sort of theory lock. And theory lock happens a lot in healthcare in my experience, which is we come into a large-scale change initiative and we say, if we can just get this one lever right, this one incentive right, as if by magic everything will change. In American healthcare, the dominant lever is payment. And I spent 3 years very recently working at CMS, so I'm very intimately familiar with this lever, but I can tell you that it's not the only thing that's going to change behavior at scale. And so what you observe in something like the 100,000 Homes Initiative is many levers. Just this ability to look at payment, but also look at recognition, also look at collaboration, also look at transparency, also look at regulation, look at all of these things on a rolling basis all the time, and basically go to where the opportunity lies. So there's an opportunism to managing these large-scale initiatives very well, which has to do with just taking advantage of everything that's available to you, because it's just so hard. It's fundamentally so hard to do this change work. You're up against so much in that crowded marketplace that you need to take every opportunity that's presented to you and sort of budget for flexibility. The fourth pitfall, I would say, are initiatives that are too logic-driven, and by too logic-driven, I mean the persuasive case that the initiative tries to make is rooted purely in evidence and reason. And we know that human beings have this whole emotional side that's crucially important. And I don't think I'm making a point that's not obvious, but nonetheless, it does need to be made. It's surprising how little I think we think about this. I always show this slide in most of the talks that I do, and ask people what they see, and most people say, I see variation in Medicare spending and quality of care. And you could show a similar slide for most public health or healthcare indicators in the country. The regions would differ a little bit, but you'd see similar variation across the country. What I see when I see this slide, and I'm not patting myself on the back to say this, is injustice, gross injustice. I see the possibility that my mother walks into a hospital in Boston, where I'm from, and gets care that's inferior to the care that she gets if she's on vacation in Maine. And that is, that's sort of the root of my energy in the work that I do when I think about this large-scale change work. That kind of conviction is characteristic of these successful large-scale change initiatives. In the 100,000 Homes Initiative, they tell the story of Ed Givens all the time. You can't go to a talk or event where they don't tell Ed's story. Ed was someone who lived on Skid Row in Los Angeles, was homeless for decades, I think, substance abuser, very violent, multiple chronic diseases. When they made their index of the people who were likeliest to die on the street in the next year, Ed was right at the top of the list. And typically what you would do with someone like Ed in the past in the homelessness field is you'd sort of say, give him some shelter when he needs it, but this is sort of a lost cause. They said something different. They said, Ed is the first person we're going to house, and we're going to give him all the services he needs to thrive, and this is Ed today. And you can feel it when you see that picture, I mean, it cuts you right to the core. Ed is someone who works in the community, works on reducing homelessness, is very successful, and just needed that belief. So tying back to these stories and these emotions is crucial, because it's where we get our energy. It's what gets us up in the morning. I think consensus is another big pitfall, and what I mean by consensus is a method of management which says, we have to agree on the intervention we're using, we have to agree on the method we're using, we have to agree on sort of everything every step of the way, and that's crippling. Don Berwick, who I worked with for years at IHI and CMS, used to say, you'd probably be mad at me for sharing this with you, but I'm going to say it anyways. He used to say, consensus kills. And it's a little bit hyperbolic, but actually the delay that it creates can actually be lethal. And so by contrast, adaptation and adaptiveness is what you see in these initiatives that are really thriving. They're able to say, we agree on the core science, we're going to do nothing that corrupts the core science, the efficacy that we've established in our trials, but we are going to make sure that we allow for adaptation in every setting, in every clinic, in every environment as we go. When I was in Sweden, I'm going to say something about Sweden here, so I wish it was about Norway, but when I was in Sweden, I met with a group in Jönköping County in Sweden, and I was really admiring some of the work that they were doing. And I said, how do you do this? How do you expand so effectively? And one of them said to me, we're jazz players. And I said, what do you mean by that? That's not what I expected to hear you say. And he said, we have a core theme, which is the intervention or the practice, but we improvise constantly, and that's a part of our culture, and that's what we do, and that's how we make change. And there was an analogy that I found pretty profound at the time. Controlling is another habit, which is we have a project plan and we want to stick to it. I think you'll find that when you are really successful in a large-scale change initiative, you've lost control of it. When we at IHI lost control of the 100,000 Lives campaign and had 4,000 hospitals around the country working on patient safety in ways that we hadn't quite conceived of, I was initially quite upset. And then we realized, actually, wait a second, we've succeeded. We've sort of bred what we wanted to breed. And sure, there were examples of people deviating from what we thought was the right practice, but we could correct that. But by and large, the benefit to unleashing people was important. And so unleashing is the concept here. I call it the John Cusack rule. It's a little bit weird, and I don't know how many of you are familiar with John Cusack. He's an actor from the 1980s and 90s. I don't know how much he's doing these days. I know he's a producer, though, because I saw him get interviewed for a film that he had produced, and they said to him, "You're a producer now. What's that like? What's your job?" And he said, I'm just figuring it out, but he said, "I think my job is to keep the set free of fear." And another sort of statement that really struck me, in the 100,000 Homes campaign, they call it creating a container for trying and failing. So they want to create a space where it's safe to do this at all times, and that creates a culture of actually being able to fall down and get back up. Another phrase they use is waste no will, which is anytime someone comes with an idea, you say yes, and then you work with them on adapting it to make it work in their setting. Managing the control continuum refers to this idea that we try in the large-scale initiatives we do to be very deliberate about understanding how much for a given intervention we're going to try to unleash people and how much we're going to try to sort of use more controlling mechanisms. There are times when laws and regulations and rules work. If you're introducing a new ID badge system in a hospital system, you just got to say, listen, if you don't wear the badge, you don't get into the hospital. That's a pretty good way to spread something, so do it, use it, take advantage of it. But when we're talking about persuading people across boundaries in multiple organizations, we have less control, and so we have to invite more of their own energy and ideas and will in order to engage them. Rigid evaluation, I think, is another pitfall, and I've heard folks here reference it already. I think that there's great value to establishing efficacy in the sort of prototype and pre-prototype phases, but what we need to do is we need to have designs that allow us to learn first and foremost about adaptation when we get to subsequent phases of work. So that we have to be able to sort of uncover and understand the nuance in the approaches that different places are taking. So by definition, a controlled approach is going to compromise that learning. And sometimes we say, contamination is not such a bad thing. We have to understand where it's happening, but actually in this sort of phase where we're socializing an idea, contamination is sort of what you want. You want people to be cross-pollinating and learning from each other. The contrast to that is daily data, having dashboards where you know where you need to be each and every day, and a rhythm of reviewing the data and responding to it each and every day. That rhythm is striking when you walk into the 100,000 Homes campaign. This is an example of a dashboard for a city. They know, if you look at the third item up, to meet their housing goal of 2.5% of their chronically homeless population every month, they're going to have to house 18 people. So it's very clear, it's very explicit, and call to call, that's what they're tracking, and that's what they're moving against. So that style of management is crucially important. The pitfall, I think, in terms of the method of teaching or the method of disseminating in a lot of cases is focusing too much on teaching. Where learning is really, I think, what we're after. And what I mean by teaching is sort of didactics, one-way broadcast of information, courses, websites, conferences. It's not that it's not valuable, but I sometimes see initiatives where the proportions are totally out of whack. 40, 50, 60% of a budget is on a large-scale change initiative is focused on these approaches. And we know that adults tend not to learn that way unless there is an accountability in the system. I think some of the ideas we heard about earlier have greater accountabilities, and I would think would be very successful in that respect. But by and large, when we're working on large-scale change, these approaches aren't as effective as this rhythmic testing that I'm describing, holding people to account for meeting data goals week in and week out, trying new ideas to try to get to a better place. Itinerant coaching, we heard about the extension agent model, actually having people go from site to site, collecting good ideas, collecting problems, sharing solutions between sites seems to be effective. Just having a field operation, getting out and sort of obsessively wanting to understand the customer, which is the adopting nurse or doctor or family or community, really deeply understanding their needs and, again, their barriers is the hallmark of these initiatives that really succeed. If you talk to Becky Canis, who runs 100,000 homes, she can tell you person to person in every one of these 200-plus cities around the country exactly what they require, exactly where they are psychologically, exactly what gets them excited, exactly what their political barriers are. You know, that kind of mastery only comes through a very organized field operation, which I think is the place to begin. Designing for success, you know, I think there's a tendency to want to make sure, naturally, that the prototype or the test works, but we can get to a point where we design something that's so top-heavy that it's difficult to scale it. Whereas Design for Scale really thinks about those scale-up factors that I talked about earlier in a systematic way and says, how can we make each of these things as lean as possible? These are the resource dimensions, that what I call testable resource dimensions, that you can constantly be tweaking in the design phase. Human resources, financial resources, physical space, technology, oversight, structures or systems, delivery requirements, the actual supplies or drug or whatever it is that you need to disperse. These are all of the things that you want to think through pretty systematically in the design phase. And I would also say you can continue to adapt as you expand all of these different dimensions. These are all things that you can continue to toggle and tweak and think about as you get to the phase of spread. I'm getting tight on time here, so I'm going to wrap up. But the final thing I would say is that business as usual, by which I mean sort of people go into work, they check their email, they have some meetings, is not what you see in these initiatives that really thrive. What you do see is a paradise built in hell, which is sort of you're like, what's that? What could that possibly mean? This is a phrase that's taken from a book by Rebecca Solnit. I don't know if anyone has read it. Has anyone read it? I always check. It's a fantastic book. She's going to owe me some royalties because I mentioned it in every single talk that I give. A Paradise Built in Hell is related to her research. She found that in times of crisis, volcanoes, earthquakes, wars, hurricanes, people looked back on those times as the most meaningful and even the most, and this is a funny thing to say, but even the most joyful work experiences they had ever had in their entire lives. Because there's a selflessness to it. There's just everybody jumping in and committing to the same cause, not caring about credit, but just feeling like you're a part of something, it's urgent, and if we do this, it's going to be so great to accomplish it that the achievement will eclipse any sort of issues of personal return or personal credit. So creating that culture, that paradise built in hell, that's the thing you see. That's the feeling you get when you observe these initiatives. You know, I've watched debriefs happen in the 100,000 Homes campaign where people are bursting into tears all the time, saying, you know, it's spiritual in some cases. I can't believe, in so many words, the good Lord has put me in a position to be a part of something so important and meaningful at some time in my life. Not, you know, you said I could leave at 4:30 today, and and now you're making me stay until 4:45. It's just the psychology is different. It's really profoundly different, and so if you have that culture, that's what allows you to do these kind of extraordinary things. I'll just leave you with this quotation. It's my favorite one, sort of, and it describes my kind of passion for this kind of work. I think when people look back at our time, they'll be amazed at one thing more than any other. It is this, that we do know more about ourselves now than people did in the past, but that very little of this knowledge has been put into effect. It's another way of saying what you said about your observation about not implementing this great research and innovation we have, but it's profound. This is from Doris Lessing, the Nobelist, and I think it is kind of mind-boggling when you stop to think that we know how to treat HIV and AIDS, and yet there are millions who don't have treatment. We know how to end chronic homelessness, and yet there are 500,000 chronically homeless people on the streets in the U.S. I mean, it's mind-boggling. So it's coming back to this emotion thing, returning to that sort of moral compass, I think, carries some weight and some heft in this work. So I'm going to stop. Again, my hope was just that to lob some ideas over that might be helpful or useful to you as you plan this work, and all the best with it. It sounds fantastically exciting. And if there are any questions, I'm happy to answer them.